Hi, my name is Dave Buck, and I'm the Executive Director at the Chattanooga Autism Center. In this webinar, I'm going to teach you about the most common resources that people seek when it comes to the needs of autistic people and their families. We're going to give you basic descriptions of each of these resources and tell you a little bit about how they're used and why they're sometimes needed when it comes to autism. Here's a list of the different types of resources we'll cover. We have a similar list on our website at chattanoogaautismcenter.org, and each of the resource categories has its own page that lists actual providers in our region. We provide their websites, contact information, and other details. Our goal today, though, is for you to learn and understand the different types of resources, what they are for, what they provide, and how much they might be useful to autistic people and their families. Our most common call at the Autism Center is people seeking autism assessments. Autism can be diagnosed as early as 1 year old, but it can also be diagnosed on through older adulthood. Pediatricians with enough training can use their medical and diagnostic interviews to diagnose patients as autistic. Trained licensed clinical psychologists and other school psychologists, on the other hand, may use and usually use standardized psychological evaluations and standardized tests, questionnaires, along with some other diagnostic interview skills to determine if individuals meet the criteria for autism. Unfortunately, there aren't enough of these clinicians who specialize in this area or who have training to perform these evaluations, and as a result, there are often long waiting lists at clinics. We tell people not to get discouraged, however, and to get on as many wait lists as you can. One thing we explain, and this is very important, is that people can usually get resources like therapy and many other things even while they are waiting for a diagnosis. This is really important to know. Some people think they cannot do anything until they get a diagnosis, and this just isn't the case. Another common call that we get is from people seeking therapy or counseling to help with mental health needs. The most common issue that comes up in our population are anxiety, depression, help with social skills, and working on emotional regulation. It's important to know that these counselors and therapists aren't treating autism. Rather, they're helping autistic individuals work on mental health issues as they would with non-autistic individuals. So for example, therapists might work with clients to help learn what is causing their anxiety and recognize what they are able to control and what they're not able to control. They might help teach them self-advocacy and that it's okay to be different. They also help come up with coping strategies for working with anxiety or helping with their anxiety, and they might help their clients practice them. Therapists might help their clients recognize emotional states in others. If clients are wanting to work on conversational skills, the clinicians might have them practice conversations and help empower their clients by letting them know that seeing things differently is okay. Helping autistic people see their strengths helps build confidence and self-advocacy. Therapists might also help clients improve their emotional regulation by helping them become more aware of their emotions and teach them different strategies, like helping people communicate with their emotions, communicate their emotions and their feelings to others. Similarly, therapists who specialize in treating depression can help clients identify root causes and find their strengths and build self-esteem and self-worth. We have a list of clinics on our website that have therapists and counselors that have autistic clients on their caseload. ABA stands for Applied Behavior Analysis, and this is a more intensive therapy that is used for children who need a lot of support. It might be used to work on severe meltdowns, aggression, hurting oneself or others, or running away. Again, this therapy is not used to treat autism. Rather, it's used to help empower children to communicate their needs and to also be safe. They can learn to tell adults what is causing them to be uncomfortable or stressed, or communicate what they don't want to do so they can gain more control over their own lives. And those who elope or run away in dangerous situations can build the skill to process their parents' request to stop or to come back. And this can take a long time to develop. The individual treatments for each individual, and then they often take a long time to put in place, many small steps each day towards building these skills. ABA therapists might spend up to 10 hours just doing the initial assessment determine the root causes of each person's behavior. The therapy then might last 2 to 4 hours a day for several days a week. And during therapy, the kids need to have many breaks and chances for the child to play and interact and to engage in different situations where they are practicing new skills. This could be 10 to 15 hours a week or more. ABA is often used to address concerns like elopement, which is running away, and pica, which is used when people are eating non-edible things or working on severe meltdowns. Communication is a huge part of ABA therapy. Kids might learn to use nonverbal communication through technology or using pictures or sign language, or they might work on building verbal communication or all of the above. Visuals are extremely important when working with autistic children. Teachers and parents are trained to use visual supports, and ABA therapists use them all the time. ABA therapists might help kids learn what to expect by using first-then boards, first this, then that. Knowing what is going to happen next or what is expected of them after they do certain tasks can be really comforting and helpful for autistic kids and might help them do things that'll keep them safe. ABA therapists also use pictures to show longer schedules or routines, or they can be used as communication tools where kids might point to what they're wanting to get or wanting to do. Visual supports are excellent tools. Let's move on to occupational therapy, which is often misunderstood. Many know that occupational therapists might work on handwriting or fine motor skills, but they do much more than that. OT, occupational therapy, is usually for individuals under 18 years old. People do not have to have a diagnosis of autism to get OT. That is, a child who is referred to OT is not being treated for autism. Rather, they are more often referred to for things such as sensory aversions, developmental delays, fine motor deficits, self-regulation, or help with daily living skills. The OTs will do their own assessments to see where the deficits are and what that OT can help that person to fulfill their needs. As you can probably tell, it's not just about teaching skills. A child might have the physical ability to brush their teeth, but perhaps the feel and the taste of the toothpaste is extremely aversive, and that's why they aren't brushing their teeth. In that case, the OTs are addressing the underlying sensory issues more than the skill itself. Many autistic individuals have sensory differences, and OTs can identify those differences and help build skills along with helping them navigate these aversive sensory situations they might have. They also might help kids work on balance or social skills as part of the therapy. They really do a lot of different things. This is another therapy that doesn't require an autism diagnosis. Speech therapists will do their own needs assessments and determine treatment plans that fit. They might work on improving verbal communication or help with nonverbal communication skills using assistive technology. Speech therapists do more than teach people how to talk, though. They might help improve understanding or receptive language skills. Other speech therapists specialize in feeding and swallowing. They might use other therapeutic strategies during their sessions and work on improving emotional regulation or social skills as well. Music therapy is an evidence-based intervention and a growing field that is slowly becoming more available. The goal of music therapy isn't for individuals to learn to play an instrument per se. Instead, therapists use music to work on non-musical goals like social communication, academic skills, self-expression, motor skills, and more. Music therapy is used for all ages and can be in one-on-one situations or in groups. The people who provide music therapy are board-certified music therapists, and in some states, insurance might cover therapy, but other states like Tennessee or Georgia, insurance companies are not reimbursing it yet. We hope to see music therapy becoming more and more available and accessible in the near future. Sometimes autistic individuals may need specialized medical care and resources that are outside the scope of a general practitioner. This can include medication management, psychiatric care, diagnostics, and referrals to other specialists. There aren't a lot of medical professionals who specialize in serving autistic individuals. The ones who do tend to be developmental psychiatrists, developmental pediatricians, and developmental neurologists. So they tend to work mainly with kids. There are some medical service organizations, though, that can help adults with specific medical needs who might have developmental disabilities. Many of these provide care management, which is helpful for people trying to balance a lot of different services. Most states have early intervention programs to help families with new babies find out if their child has disabilities and how to get assessments, services, and support as early as possible. Parents who notice their infant or young child might not be hitting developmental milestones, they might want to get an evaluation and find support as early as possible. Typically, early intervention programs serve kids birth through age 3. In Tennessee, our program is called Tennessee Early Intervention System, or TEIS. With TEIS, a representative comes to the family to conduct an assessment and then helps coordinate services as needed to meet goals that are established within the family. Babies Can't Wait is the Georgia equivalent. As kids age out of the program, the early intervention specialists help parents and kids set up with the local education departments and other service providers so the child can continue to work on developmental goals and be ready to start school. When a child turns 3 in Hamilton County, parents can choose to use a program called PALS, where preschool age kids receive psychological assessments and psychoeducational assessments, through the school system to see if they qualify for individual education plans or preschool placements and other support. If you're not in Hamilton County, you can call your local school's exceptional or special education department and ask if they have programs for kids 3 and up that help assess and determine what supports might be available that the school can provide. Now, I put parent support and education issues together because many of the resources are the same. Also, one of the most common reasons parents are looking for support is because their child is struggling with school issues. Support groups help connect people with other families who are going through similar things. Some are online, like various Facebook groups, others meet in person. There are also agencies who specialize in helping parents navigate the special education system. These agencies can help answer questions about individual education plans, IEPs, or 504 plans, and they help guide parents through the process of getting assessments and therapy services through the school. Sometimes individuals temporarily need more support than can be provided in the home or from a regular weekly meeting with therapists. Inpatient programs provide extensive therapy and 24-hour care for people with moderate to severe mental health needs. Some programs focus more on adults and some specialize in pediatrics. Unfortunately, it can be difficult to find inpatient options with a focus on autism or other developmental conditions, but they are out there. It's not uncommon to have to travel out of state to find specialized inpatient programs. Inpatient programs are short-term with the goal of helping the child or adult stabilize, and then for them to be able to go home once they're stable with supports in place. This might take a few days or a few weeks. Residential programs are for those who need long-term care and support, but are not in a mental health crisis. People might live with several roommates in a residential setting and have special support staff that come by or who are available at all times. Some may have programs that help increase independent living skills or helping them be more involved in the community. Residential programs become the individual's long-term home. Here are some common types of resources for adults and teens. Sometimes people are looking for ways to connect and find help or support or be with people with similar lived experiences. Specialized support groups can help people feel less alone, make friends, and get ideas and suggestions from others. Independent living and employment are another common adult resources that are sought. We get many calls from parents or autistic individuals who are needing help finding jobs or becoming more independent. And there are programs specifically designed to help people with disabilities learn practical skills like cooking, grocery shopping, budgeting, scheduling, or driving, or using other transportation services. Often the overall goal is to help people better live, to be able to live on their own and have more independence in their lives. Voc Rehab, or vocational rehabilitation, focuses on employment. These programs are typically run through the state and provide things like job coaching, skills assessment, job placement, job development, and sometimes they also help improve independent living skills and help with transportation. ECF Choices is a program through TennCare, which is Tennessee's version of Medicaid, that pays for services like the independent living programs or for voc rehab type programs. They might help with community integration and especially focus on programs that help with employment goals. If you're not in Tennessee, you can check to see if your state has something similar. All right, again, here's the list of the types of resources. I hope you found this informative. If you want to get more information on these categories, you can go to ChattanoogaAutismCenter.org, find the regional resources page, and you'll see all of these categories listed, and you can click on each of those categories to find specific resource providers within this region. If you have any questions, you can always call the Autism Center directly. Our number is 423-531-6961, option 0.